Clinical neuropsychologists often take on 4 different roles in practice: the evaluative role, the educational role, the rehabilitative role, and the medico-legal role. This video is focused on the educational role. The others are each explained in their dedicated videos. Links are listed in the description. Neuropsychologists often stand in a central position in a multidisciplinary team during a consult on a case of brain-impaired patients. It is during this time that they will take on an educational role, particularly for the purpose of communicating the ways in which services of a neuropsychologist might benefit the patient. There still exists at least some degree of confusion around just exactly what a neuropsychologist does, as reflected in referrals that are far too general. For example, it is not uncommon for neuropsychologists to receive requests like, "For neuropsychological assessment, please," after providing only brief clinical histories of the patient. The hope is that as referral agencies become more aware of the use of neuropsychological evaluation, the requests are more meaningful and the background information provided about the patient more directly relevant and informative in helping to shape the nature and scope of the evaluation. For example, a good working relationship between a neurologist and psychologist can be exemplified in a case study reported by the Australian neuropsychologist Dr. Kevin Walsh in 1978. The referral question reads, "Does this patient have an amnesia to which she is not entitled?" The patient was a 56-year-old female who complained about episodes of sudden detachment from reality after a head injury 15 years before in the right temple. EEG recordings revealed the presence of a left temporal focus but no electrical abnormality on the right side. Drug therapy yielded no success in treating the symptoms, and therefore a left unilateral temporal lobectomy was proposed. It was at this stage that the neuropsychologist was asked to offer an opinion about the suitability of this plan. This referral assumes that the neuropsychologists know about the double dissociation shown in the lateralized temporal lobe lesions between verbal and non-verbal memory. In this case, we would expect to see the patient to be differentially weaker in verbal memory than non-verbal memory given her pathology. This would be a deficit to which the patient is entitled. However, the question about the not entitled amnesia would need to be addressed by her performance on non-verbal memory tests like visual reproduction in the Wechsler memory scale. This is important for the neurologist to know because non-verbal memory impairment can still persist under the disguise of a normal EEG, and that a surgical ablation of the left temporal lobe might add to the damage in a previously unsuspected right side. As a result of this, patient might be significantly debilitated by the surgery and suffer from a general, profound, and lasting amnesic syndrome. In a sense, neuropsychological evaluation can be conceptualized as the upper end of neurological exams in the top-down relations between the mind and behavior. As Dr. Kevin Walsh argues, no neurological examination of cerebral function is complete until the neuropsychological evidence is in. Therefore, it is the hope of this video to demonstrate how having a sophisticated understanding of the ways in which different medical professions complement each other can improve the quality of patient care, as this is particularly important when the patient is monitored by a team of professionals. It is also for this reason that the process of writing up a professional opinion should always have the specific reader in mind. In conclusion, education about the use of neuropsychological assessments can improve the quality of patient care. The communication gap between the neuropsychologist and other professionals can be addressed by educating more about what neuropsychological assessments can provide for patients with brain impairments. Specifically, this can be achieved by engaging in regular and frequent discussions, establishing a shared knowledge base and terminologies.